So a lot of times patients will come in and tell me that they've got TMJ going on. And so first and foremost, I want to say that, although most people refer to it as TMJ, what you're actually experiencing is dysfunction of that joint. So the technical term would be TMD, where it's temporomandibular dysfunction. But just so there's not any confusion, and most people refer to it as TMJ, I think we'll just call it TMJ. And so a lot of times when people are coming in, when they come in for their exams, we always kind of check that area, see if we see anything, shifting one way or the other. We look for evidence of wear on your teeth, things like that. When we're doing our exams, when people are coming in saying that they've got a problem with their TMJ, it's usually some type of pain. Most people will tolerate clicking or popping as long as there's no pain associated with it. But most of the time when people are coming in because they're noticing something, it's most commonly pain, it's disrupting their normal everyday life, or they've noticed some sort of shift or change in their bite. And so TMD really can cover a wide range of problems going on. There's disc stuff that can be going on within the joint itself. A lot of times it's muscle issues that are going on around the outside, and so if you've got a muscle that's pulling one way more so than the other, that's going to cause an uneven or an imbalance in the back. Other things that can really make that flare up, sometimes some chronic health conditions, episodes of stress, maybe you're doing a little more clenching or grinding, and so we might call that acute TMJ instead of a chronic type TMJ where you've got kind of pain in there all the time, or a situational TMJ that comes on when you're more stressed, that sort of thing. And so it's really important to have somebody who knows what they're looking for help figure out what's going on, because the treatment for a displaced disc or something going on within the joint is somewhat different than what you would do if you had some muscle issues going on. The other thing that we tend to see is a lot of wear in some people that have issues with their TMJ, or a lot of flattening of the biting surfaces back there, because again, maybe some of that clenching or grinding over time that's causing some of the trouble back here, or maybe the trouble is kind of contributing to that. And so a lot of times, probably the most common types of treatment that we do in our office are mostly behavior modification type treatments. We'll also talk about the possibility of an appliance, something that you'd wear while you're sleeping. There are some daytime appliances that we can use as well, but really determining what's going on kind of helps us get to how do we fix that. But TMD is an area that a lot of people aren't super familiar with, and it kind of falls in this gray zone. Is it my dentist? Is it an ear, nose, and throat? Is it an oral surgeon? Is it a primary care provider? And my suggestion would be to start with your dentist, because they spend a lot of time kind of learning about that area, and they have a lot of good knowledge. So a lot of those initial therapies will take care of most of the problems that people have. It also goes hand in hand with your jaw position. So we also offer orthodontic services here, and sometimes by changing kind of the position of your bite or how your teeth come together, it actually relieves some of the pressure on the joint back in here. So there's a lot of different treatment modalities. Some are very simple and straightforward, and some get a little bit more complex. And so really starting by talking to your dentist is probably your best option.